All right. Thank you. Thank you, Karan. Uh, Very warm welcome to all the delegates and the faculty present. Today, we are going to be having yet another interesting session of Fertility Science Research Journal, where we discuss about the nuances of publication. Our first talk is going to be by Dr. Jayesh Amin, Clinical Director at the Nova Wings IVF Group and a National Advisor to the Indian Fertility Society. Uh, there are multiple positions he holds. He's quite known now in the field of fertility, where he's been a president association of reproductive genetics and immunology, organizing chairperson of the latest Fertivision, the IFS conference in 2024 December, past additional joint secretary of the IFS, past convener of the Fertility Preservation Society, with over 20 years of experience and more than 30,000 plus IVF pregnancies, a huge experience, has been awarded excellence in IVF treatment by Union Health Minister of India in the year 2016 and a gold for excellence in reproductive endocrinology in the year 2024. Over to you, Dr. Jayesh, for your talk.
Yes, thank you so much for kind introductions. And I'll be more precise today to manage my time. So around 20 minutes, which was given to me. I'm just sharing the slide. So I will request Dr. Just sharing. Please count my time after sharing the slide.
Sure, no problem.
So I think so my slides are visible now. And I'm just putting it in the so
You need to
let's
go
see.
to the first slide, sir.
Yeah. So writing discussions in the research paper, and I know that people are always reading about the discussion is one of the most important part of the whole paper, where you can find out something which is what are the things that are going on. And let me discuss about abstract. When there is a research paper, the synchrony of the research paper will be starting from abstract and will be landing up to conclusion, and where in after results and methodology, the most important part is discussions. So what you need to include in discussions, how you can just start with the discussions, which part of the research do you find most difficult to write its discussions? Let us discuss and how to write a discussion. So first thing, role of discussion section in a research is to interpret your results in the light of what is already known. So there are a lot of papers which was already published. So you need to write out what is already known and to explain the new understanding and solution, that whatever you are discussing, is it really pertaining to the problem? During that discussion, during your research, what exactly new thing you find out to taking about that paper, that is what you write down in your discussion. And what questions are supposed to be answered by a good scientific discussion? That do your results provide answer to your study question? If yes, then how do you interpret your results will be there? The second thing, do your findings agree with the others? If not, then do they suggest any alternative explanations for some flaws in your study? That is also important in discussion. And the third part is, what new understanding do you suggest for the problem questions you have investigated and studied? If needed, what would be the further step? Example, what experiment would you like to do for the further? And let me the part of discussion, if we have a circle of summarizations, then where we can start. First, you can start with the explain the meaning and importance of the finding. Always there will be inside there is a comparison, and after the comparisons, before the comparison, I think so there will be a finding that you need to just explaining all your results in a very deeper way. And later on, you need to every study do have a certain limitation of the study, and then you can have your conclusion, your results conclusion will be there, that how it helping toward the publish this paper. So let's get started by this one by one. The first, this is my own paper which was published, and it is a significance of FSHR and LH receptor, the genetic polymorphism on clinical outcomes in gonadotropin releasing hormone in antagonist protocol. And is a retrospective case will be there. And this study, if I ask that how I can start write the discussions, look at that how I started in discussion. Start on with the same thing, that significance. So what you are going to say that the same thing, you start the discussion by restarting the statement of the problem and briefly summarize the result where you can start. So I already highlighted that how you start the same thing. The title of my paper will be going to be start again, that we need to start like discussing the starting, restarting the statement will be there. Then what the second part is results. After the statement, you can just discuss brief about the results. Try to frame and concise. First, you have to frame it out your concise statement of main results that directly answer the central research questions. The same thing in this research, I say that these results suggest that LH supplementations may particularly benefit individuals with the LH polymorphism genotype undergoing controlled ovarian stimulation. So this is what the concise statement of the results that I will directly answer inside. Now the furthermore, after this concise statement, you need to explain very deeply that what are your results will be going to say something around of your publication. Explain the meaning and importance of the finding. So here I already said something about that. Whenever the FSHR 680 receptor is there, it was found that high dose of the FSH is required. It was found that the basal FSH level is higher. It was found that the number of the oocyte required, which was very less compared to the high dose to compared to the low dose of the FSH. So anyway, if you are having a FSH R680, then you require high dose of the FSH. And in the same thing, I explained that when there is a LH receptor polymorphism, adding HMG or adding LH, whatever the LH like activity, will help to reduce the hypo response. So this is how I explain the whole internal explanation, the detailed explanation, the meaning and importance of the findings in yours. So starting from the results, you can briefly concise, and then you can go in detail and find out the meaning and importance of the finding. You need to go ahead in the writing down the discussions. Now, after the results, so first you frame out, then you having a results, detailing of the discussion of the results. Now, the third part is that you need to compare to the previous study. You need to compare, and the comparison that what are the similarities, what are the dissimilarities which will be there in study and the previous study. The previous study might be same like that, whatever the suggestions, what are the outputs are that the same outputs by your study also, that you need to find out. And relate your findings with those of the other published studies will be there. Always compare. So comparison is more important. And let me say something in my study. You can see something how I compared with the Tang et al. Meta-analysis stated that the FSH dose and pregnancy rate were not influenced by FSHR 680 milligram. However, it's discordant. So the present study observed that the total FSH dose in antagonist protocol and pregnancy rate were dependent on the FSH receptor polymorphism and further influenced by the additional serine of LH polymorphism. So this is how I compared with the previous study. If it is not, the statement is discordant to the previous statement, you need to explain, and this is called a comparison. In the part of the discussions will be there. Part 4 will be provide alternative explanations of the findings of your study. Discuss any unexpected results. So what are the unexpected results? Remember that the purpose of research is to discover and not to prove. While designing a research, it's quite common to get trapped to prove your bias rather than discover the truth. Therefore, in a discussion section, consider giving all possible explanation of your study results rather than giving what you want to give or what fits your bias will be there. There is another option that we need to also mention in the discussion, and what exactly that another options about your whatever you mentioned, that receptor polymorphism. Here I mentioned that AFC and the AMH, which is again a prime used as a biomarker to find out to know the response of the ovary against the stimulation. So that is, you need to find out that what are the alternative of your publication, that what alternative we can use compared to your publication that already I mentioned in my study. So now we have a clinical relevance of your findings. So you need to find out the usual aim of the study in medical to prove something which may improve the patient's care. So discuss the finding of your study in clinical context. Result of some experimental studies done on animals and not involving humans can be implemented to improve and develop newer modalities of diagnosis and treatment of the human subject. Explain clearly for which patient do the results apply and for which patients do not. So here I already said something, the conclusion and relevance, that overall this study contributes significantly to the existing literature by elucidating the role of this specific gene polymorphism in freeze-hold cycle. That how it is, the conclusion is that the presence of serine in FSHR polymorphism was associated with the higher RFSH doses requirement, and both FSHR and 680s and LHCGR 312S polymorphism significantly influenced clinical pregnancy and live birth rate outcomes in freeze-all cycle. So this is how you can explain in conclusion will be there. Now the other part is more important, the visible thing. Sometimes the eye will visible 1 MB, but rest of the 3 MB which is not visible with our eyes. So what I want to say, it is the limitations. It's every eye is having a limitations, that you need to consider the limitation of your study. What you observe, but what is, every study has to have a limitations. No study is without some or other limitations. As a researcher, always acknowledge limitations of your study to enhance credibility of your work. Limitations may be related to your study design, methodology, or emergency of any unexpected issues faced during the study period. Also discuss the impact of the limitations on your study. Unfortunately, sometimes limitations may so fatal that precludes its publications when reviewed by peer reviewers. So always ready for that. Always you are out down your limitations. Possible types of research study limitations: smaller, insufficient sample size to generalize the finding, to reach to a conclusion, to wider implication, to apply appropriate statistical tests. So lack of ample number of previous studies, published data on topic, limited access to data, challenge due to non-availability of standardized method, instrument, and latest technique will be there. So this is, however, I already write in my study, if you see something, however, a weakness of the paper is the need for a comparative analysis of clinical outcome between the fresh and frozen. Overall, this study contributes a significantly to the existing literature by elucidating the role of this specific gene polymorphism in freeze-all cycle. What about the recommended? So lastly, we can say recommendations and suggest a recommendation that while your study answer the key question and most of the related questions, still some question remain unanswered or undiscussed. Also, some untouched area may emerge as more research centric after publication. Therefore, always provide suggestions for need for further research and study. Here, what I say that overall this study contributes a significant to the existing literature by elucidating the role of this specific gene polymorphism in freeze-all cycle. So let me say something summarized to the end, that how can I go ahead? We'll start with the writing the title. We'll discuss the results. First, we'll discuss the abbreviation of the results. Then we explain the results in the deep, and then we can compare with the other study, and we can have another option. Then we can write down the another options, and later then we can conclude in the discussion with the limitation of the study should have to have a part of the study. But what should be avoided in a good scientific discussion, that is not don't do, and that is called unproved or unwarranted speculation. Do not try to prove something without firm supportive evidence. Do not over present your results. It is very easy to inflate the interpretations, but don't do it until it is supported by data. Overinflation of your importance of your findings. After so much of hard efforts of you, it's very common to attribute not needed extra importance to your findings, but don't do it. And do not conclude any such thing which is not proven by data. So these are the things which are the don'ts of that. And tangential issues diversion, avoid distractions, remain focused on hypothesis and results. Inserting tangential issues confuse readers and leads to risk of dilutions, may confound the real message of the research. So the bully, this is what I want to say, don't do bully. Never criticize other research in your discussions. Comparison with previously published studies must always be done professionally, and don't attack other researchers. never sermonize the readers. So this is most important. The last two slides is so important in your discussion will be there, and discussion should be end with the certain message, and also the do's for clinical writing elements, that always read the guidelines of journal before hand to maximize the chance of the acceptance. Always get proofreading by a professional embers active voice. Don't commit grammatical errors. Use the present tense and maintain an objective and analytical tone. Use reliable sources of the information for your research. Always be ethical. So this is all the do's for the writing elements. So in a nutshell, my conclusion: fulfill the promise you made to your readers in your introductions by writing a scientific discussion. That is what my at the nutshell discussion will be there. And these are the reference which was used by me to find out this lecture. Thank you so much.
Dr. Amin, congratulations on your splendid presentation. You think I didn't see the 2 spelling mistakes, don't you? So the question for the panel, not for the panel, right? And Dr. Amin has done this deliberately, right? Because he spoke about correct English and grammar, right? And one very good way of checking whether people are paying attention is to check this. I also congratulate Dr. Amin for keeping to excellent time and speaking very clearly about the slides. So that leaves time for 1 or 2 or 3 questions, not from the panel, but from the participants. The participant may not necessarily ask a question, but can identify what the spelling mistake was. Any volunteers from the participants for questions to Dr. Amin on his clear, informative presentation? Dr. Agrawal, you can pretend to be ask a question.
Okay, sir. First of all, Dr. Jayesh Amin sir has concluded everything and involved everything in so much of detail that every participant must have benefited a lot from this. But let me just ask one question to sir, that if I am new in writing a discussion, that already you have explained, but I just want to listen again, that what is the biggest mistake I should avoid while I am writing a discussion? Dr. Amin, please.
I think so. Biggest mistake, it is all about that. Last thing I can say, you can't do something about critics to have a different publication which are existing. So don't criticize. And I think so. You should always means the other second big mistake is that whatever your the results are there, which is not fulfilling the of your publication, means your title of the publication. These are the 2 things I think so. If it is there, then there is no worth of this paper.
Yes, sir. Thank you so
Thank you.
much, sir.
Thank you.
One
Thank
question I
you.
would like to ask to Dr. Geddes, sir, as well. That, sir,
Yes, please.
what mistakes could be there which can lead to rejection of our paper in the discussion part? Can you just brief our audience for us? Dr. Geddes, sir, please.
So thank you. Dr. Amin
Yes.
mentioned it in passing, but the important thing is for the references in the article to be current. Current meaning recent. So of course there are references that may be 10, 20, 25 years old, of course. But what is important is also that we should acknowledge the work of others in real time, that is in the last few years. So there should be adequate reference to existing research. So that's terribly important. And the other thing is is to fully describe the methodology. And it's but if not not necessarily word for word, but with reference to. So, for example, if it is a laboratory technique, and here Dr. Amin's paper, which he used as an example, there he described, the methodology of the relevant factors. So, topical referencing and full description of methodology, not just tests, but also description of patient, patient population, and so on. So should anybody wish to do a similar study, they have access to the same research tools that Dr. Amin's tool has. I hope that answers your question.
Yes, sir. So one more question. What is the maximum number of permissible studies which we should keep while comparing? I mean, what is the ideal number of studies with which we should compare our results in the discussion part?
Thank you. That's also very important. But any of the faculty can answer, but I will start the ball rolling. So if there has been a lot of research, then there may be a literature review of the subject. So that should, that's a good starting point. And then key references that are, or if more recent, are not included in the literature review. So to minimize the number of references from 200 to say 20 to 30, inclusion of the relevant high quality literature review is helpful. Dr. Amin, what do you think?
I think so. I'm agree with that.
You are very agreeable and you're absolutely correct. Jayant, that's your thinking look. What do you think? Unmute.
Yeah. That's a very interesting question, Dr. Udry. When I sort of look at review papers or any other publications for peer review, I'm always looking for a comparison between the most recent publication, comparing the findings of that individual with those recent reviews. So I would at least look at 5 to 6 maximum references, which would be comparing or be along the same line as the ones that I'm publishing. Because what it does, it brings up your study in line with those which have been published, and you're comparing and discussing in great details as to how you would be able to improve on that. So that's what I would suggest to you. Because you asked for a minimum number, I would say not more than 5 to 6. However, having said that, what is also very important is that you should not overwhelm the readers with so many different comparative research. You need to be very specific. You need to choose which ones you're going to be using, which have a meaning, and for the comparison things. I hope that answers your question.
Thank you so much, sir, for the crisp and concise explanation. I think I request Dr. Rupali ma'am to go ahead with the session, please.
Oh, so one last question. Sorry, one last question. Dr. Amin, how many references did you have in your example paper? 20, 30, 50?
Sir, I have read that paper and probably it is more than 30 because
No. There is a
polymorphism has
list at the end. There's a list at the end
Yes.
with numbers next to it.
Yes, sir,
Dr. Amin,
because the
how many?
polymorphism, yeah, because polymorphism is something which is very new
No,
topic.
not the polymorphism. All I want to know is the number of references. 15, 23, 61?
It is around 34 references are there.
Around. You're a scientist, so you don't use the word around. It is 34, or it is not. Thank you. Moving on, Dr. Rupali, please. Thank you, Dr. Agrawal, for your excellent question.
Thank you, sir. Thank you so much.
Professor Geddes. Thank you, Dr. Jayesh and Dr. Rudri. Now we move over to our next talk. For this, we have invited our statistician, Dr. Ashish Upadhyay, who's a scientist in biostatistics and clinical research unit at the All India Institute of Medical Sciences, New Delhi. Has had several publications, and his main areas of interest are biostatistics, epidemiology, survey technique, systematic review, and advanced regression models. Uh, Over to Dr. Ashish for his talk. You can share your screen and your presentation.
Good evening, all. I'm Dr. Ashish from as a scientist biostatistics in AIIMS, New Delhi. Okay, my topic is which test to apply when. Okay, first of all, in any research paper, you have to see. Okay. First of all, what are the key questions in any research? Whether we are estimating anything or testing the hypothesis, or means testing the proportions in between the two groups or association of the any predictors with outcome. Like whether the infertility is more in uh, obese women or non-obese women, or relations with whether we want to see the whether the as BMI increases, the hypertension increases, that is in a categorical form, or you can say that as BMI increases, whether the insulin or blood glucose increases or not in the women. The factor affecting the selection of the test, whether we are assessing the relation or association, like if both outcome and exposure are categorical, means if we are comparing the infertile women and non-infertile women, and what is the BMI, they are obese or non-obese. Because here, if we categorize the BMI in obese and non-obese, and the women which are fertile and infertile, and we want to see whether there is any relations between the obesities and infertility. In that case, we have a both outcome and exposure. Here, I think you can say that the BMI is related with infertility or not. Means we are saying that BMI has any effect on the infertility or not. Or you can say obesity has any factor, any relation with infertile or not. In this case, both are the categoricals. So this type of relations is maybe we want to assess. Otherwise, other thing which we want to assess, whether the obese women and non-obese women, whether the blood glucose level is high or not. That in this case, what it is, the obese and non-obese are the categorical form, means whether they may be obese, they may be not obese. And we want to compare the blood sugar level among them. Blood sugar level means they have a higher blood sugar level or low. But in the case with we want to change it in diabetes and non-diabetes, then it also becomes categorical. So when we take any quantitative values of the outcomes or exposure, then it is called, it is this case categorical versus categorical. And the third case is what? Quantitative versus quantitative. Means as BMI increases, blood level, blood sugar level increases among the person or not, that can we want to assess. It may be medically not proven, but we can assess it. Second thing, which is most important, play a role in deciding the test, that is the number of groups. Number of groups means whether we are comparing between the two groups or more than two groups. Test changes accordingly, comparing two versus multiple groups. Next thing which we should always see, distribution of data which we are applying the test, on which we are applying the test. Distribution, generally, we in the statistics, all tests are, 90% tests are based on the normal distribution. So normality should be assessed before applying any test. So normal versus non-normal also decide the test which we have to apply. And the study design, whether this is the study design, whether we have comparing the two independent group, means subjects which are independent, means we are one group, we are giving the intervention, other group, we are not giving the intervention. They are independent group and we want to compare their age or BMI level. We want to compare, that is a independent group. And paired group, if we are giving any intervention of the controlling the blood sugar and we are observing it after some time, after the intervention, and what is the level of sugar, blood sugar after the 3 months. That is a paired data because we are observing the subject from baseline and after the 3 months. So test also depends on this. So first of all, we depends on the test, depends on which type of variable we are considering. It is qualitative or quantitative. Qualitative variables are nominal, in which there is not a order like gender, male, female. We cannot order it, which is higher or lower. In this case, this is a nominal variable. In the ordinal, like in a cancer, stage is there. First stage, second stage, third stage. So there is some order and it is a categorical. So in this case, we called it ordinal. And the discrete variables, like number of parity, it cannot be 1.5. It can be 1, 2, 3, 4 in the woman. So this is a discrete variable which take any integer variable. But in the continuous variable, we can have any value between 0 to 1 or 1.5, 1.6, like in the case of weight, it can be 35.5, 35.2. These are the continuous variables which we are defined. So all of you who has some idea about test, they should know what are the normal distribution. It is the most common distribution which is used in the statistics. It is a bell-shaped, and most important things, it 90 mean plus minus 2 as the represents 95% of the population in which it is given. So it gives the greater idea with only the true representation of the average. So if it distribution can be not normal, then it can be negative skewed, means there are more lower values and mode is higher, and mean value, if it is a more higher value, then mean diverted from the right side, then it is called positively skewed. And in the normal distribution, different test is applied, and in this negatively skewed and positively skewed, different tests are applied in this one. So generally, these are the main distribution difference between parametric and non-parametric. But I will only focus on the rule of thumb, which decides which test to apply when in the common tests. So if we take the average of the any variables, which is interest, which is in our interest, if means half is more than SD, then we generally apply in the statistics and biostatistics field normal distribution, means parametric tests like t-test and pair t-test, ANOVA, and this. If this assumption does not fail, we straightforward do the non-parametric tests like Kruskal-Wallis, rank sum, which are the non-parametric tests. So the first case, categorical versus categorical. We want to compare where the infertility is associated with obesity or not. So our question is, fertility is associated with obesity or not. So fertility can be defined as infertile or fertile among the women, and outcome exposure can be a what? Obesity, obese or non-obese women. So in this case, both are what? Categorical. So our test should be what number of categories is there? What? It is a 2, means exposure has a 2, means whether it is obese or non-obese woman. And outcome is what? Infertile or not infertile. So there are exposure categories are 2 and outcome categories are 2. So in this case, we apply the chi-square test or FSR test. Chi-square test is used when all the observed frequency or observed frequencies are more than 5 in each cell. If this is the general assumptions which should be obeyed in the chi-square test. If it is not obeyed, then we go to the FSR test, which is a test which is more robust to apply in the that cases where the frequencies are less. And if you want to say that if obese women are there and we are giving some intervention like exercise or this, and what changes occurs after their FSH levels and other in after 3 months. So whether their categories of obeseness changes to non-obese or we want to see that is a paired data. Means if we are giving some exercise training and they are obese women, and after 3 months we want to see whether their obese category has changed to normal or moderate BMI, then we can assess by a McNamara test. This is used when paired data is there. But if there are more categories of the outcome, like the stage of the disease, stage of cancer, and we want to assess what the mortality or what the their mortality occurs or not according to the stage of the cancer, then it is a unrelated data, but there are more categories of stages. Then the test remains same in the categorical versus the categorical, but it always changes in the categorical versus quantitative data. And this data, and here, if we want to compare the FSH level in infertile women and fertile women, generally what happens? FSH is first we have to test the FSH has a is following the normal distribution and non-normal distribution. Whatever I have observed in our day-to-day work, that FSH doesn't follow the normal distribution in 99% cases. But for the example, we want to compare not obesity. We want to compare that whether the infertile woman and the fertile woman have a higher level of BMI or not. Just we want to compare this, that the women which are infertile and women which are fertile, whether the level of BMI is high among the infertile women or not. This is my hypothesis. So outcome is what? BMI, infertility, and exposure is BMI. But we want to compare that whether we want to compare that the BMI level is high among the infertile women or not. So in this, the one variable has a 2 category and other variable is a quantitative variable. So in this case, it is student t-test is applied. But in the similar, if we are giving any intervention and we want to see whether the BMI of the infertile women are changing with exercise or not, then it is a paired data. If we are giving the exercise and for dietary intervention to them and want to see whether there is an effect of the exercise and dietary intervention after 3 months. So in this case, because we are observing the same infertile woman after the 3 months. So this is a paired data. So in this case, we apply the pair t-test, whereas we want to see that in the second case, what we have said that FSH level, which is generally not follow the normal distribution, and we want to compare the infertile women and fertile women, then in this case, we apply the Wilcoxon-Ransom test, and we want, in here also, we want to see that if we are giving any dietary interventions and exercise to the women, and we want to see whether the FSH level has significantly changed between baseline to the 3 months, then we can compare it by Wilcoxon sign rank test. First, second thing, which if we have a more than 2 category, we want to see, compare the stage of disease and the stage of cancer among the women. What are the stage of cancers and their hemoglobin levels among the blood cancer women, and because generally hemoglobin levels follows the normal distribution, and stage of cancer has a more than 2 categories. So we want to compare it, then we apply the one-way ANOVA. And we want to see the hemoglobin level changes after 3 months, 6 months among the cancer women. And so we are observing it more than 3 points. So here we cannot apply the pair t-test, because pair t-test is always applied in the case when we have a 2 repeated measure observation. But there is a more than 2 observation, then we apply the repeated measure ANOVA, which is a parametric form of test which is applied when there are more than 2 points of observations. But same, we want to compare the FSH level or other things, some FSH level among the stage of the women's stage of the cancers. We more than 2 categories. Non-parametric subordinate of counter is Kruskal-Wallis test, and whereas for repeated measure it is a Friedman test which is applied in this case. And the quantitative parameters, quantitative means both are a continuous variable. In this case, we apply the generally in the parametric Gall-Pearson correlation coefficient. You have to see that in this case, both quantitative variable X and Y, like if there is, we want to observe the BMI with hemoglobin or BMI with blood glucose, both follow the normal distribution. In this case, if both follow the normal distribution, then we apply we want to assess the correlation, then we apply the correlation coefficient. If any of the variable is not following the normal distribution, means if we want to see the relation of BMI with FSH, one is a parametric and other is what? Non-parametric. In this case, Spearman correlation coefficient is applied. This is a non-parametric form of the Gall-Pearson coefficient, and this is generally represents the relations between this. And we can summarize the all decision tree for selecting the appropriate test, whether we want 2 or more, ANOVA is applied. If one, same subject, same parametric, it is a pair t-test, and if it has a non-parametric, Wilcoxon sign test. If it is a different, parametric is t-test, and non-parametric Mann-Whitney. If we want to correlation, then parametric Pearson correlation, non-parametric Spearman rank correlation. In the categorical, parametric chi-square test. Thank you. Any questions?
Very much. Thank you, sir. And thank you very much for keeping to time. Any questions from the delegates before Dr. Jayant makes a brief comment? Delegates? Delegates. Dr. Jayant, pretend you're a delegate. Ask the key question here.
Dr. Ashish, thank you very much for a very concise presentation. There was a lot to be taken within a short period of time. What would be the key areas that you feel co-founders would influence what t-test or what statistical analysis one should be taking?
The statistical analysis is always based on the hypothesis which you are going to test it. So when we review any papers, we just check the hypothesis, whether it is a hypothesis testing or a estimation study. And after that, we want just check it out. You should check out, or we should check out whether this is following the normal distribution or not. First of all, what is the sample size? What is the distribution of the data? And then what test should be applied? In the third step, we have to check it that what test should be applied at that. So first of all, first key question is whether we are testing the hypothesis or estimating. And in the second, whether this relation is the test variables are normal distributed or not normal distribution, and how many categories of the exposure have. Third thing, and then we have decide the test what should be applied.
Thank you. Just one more question, Dr. Ashish. When you spoke about the sample size, I feel that a lot of authors or the researchers always have a difficulty in deciding what the sample size should be. Can you briefly describe how you, if you were a researcher, would decide on what sample size should be?
Yeah, we just, if there is no previous research is there, then we always suggest that go for the pilot study, taking at least, if you want a appropriate statistical test to be applied, it more than 10, or we generally refer it more than 25 should be there. There is a reference that generally take 25. For the other case, if there is you are comparing two drugs, one is the standard form, which is generally used, and new drugs which you want to compare it. And your outcomes in the standard form, it is available. So we just ask the clinician in that when we calculate the sample size, what you estimate that better result, how much better result should be come in new drugs. If it is clinically meaningful, means clinically meaningful, one person can say that I will get 80% more result in this. This cannot be a clinically meaningful, or it cannot be a wonderful. Any drug cannot be so much wonderful that increment of 60-70% occurs. So in that case, we always make the question mark. How you decide this? Whether there is any reference for this. So this is the key area which we target for before deciding the sample size. Just clinicians comes up to us in the aims, and he give us the logic behind what the new drug can be more effective, and there is any basis for this. So generally we take 10, say 20%. Now what happens that all drugs are near about their last level. So now the cases are arising for the mainly clinical trials is a non-inferiority or equivalence it is going on. So this is the most area which the people are coming in aims, not for the superiority of the drugs in the your gynae field.
Gaddis?
Thank you. Dr. Ashish, thank you very much. Okay. In an observational study, does that N value remain at 25 to 30?
Yeah.
Thank you. Thank you. The other point is which is the most common error that might be made by a researcher who is a beginner?
Most in the statistical part, they apply the advanced statistics in a small data. For example, they are applying the regression in the 10 or 15 cases subjects, and they are giving that and they always write it like a predictor. Predictor cannot be such a small data. You cannot say that this is a predictor. And in the observational study, generally people don't write it associated variables. They write it, they are the predictors of this one. This is the general error which we observe in the papers which comes to us.
Thank you, sir.
Oh, thank you, sir. Thank you, sir.
Participants, I will nominate a participant to ask you a question.
Okay.
Yes, exactly. Dr. Swastika, please ask Dr. Ashish a question. Dr. Rupali, have I not been gentle enough?
Dr. Ashish, can I be permitted to ask a question?
Yeah, ma'am.
So as a reviewer, when we review papers, when we look at reviewing these papers, apart from the fact that you said that we should look at categorical variables and then look at the kind of test, if we look at the p-value, how can we know that this p-value is fudged? Can we kind of make out just by looking at it, or we really need to go back to the statistics and try to calculate it, and then only we can
Madam, just we have to say that report their confidence interval. And confidence interval, because generally in the clinical trial, it should be confidence intervals should be reported. Okay, different confidence interval, it clearly shows whether there is a statistical significance or not. Okay, if confidence interval is overlapping one other, then there is the most of chances that it will be a non-significant result. And people, and the correct p-value should be reported, not less than 0.05. It should not be written like this. It should be written at 0.023. Okay, but important loophole is there in a statistic. If the person is reporting a non-parametric test, now reviewer cannot assess whether it is a significant difference or not, because no online software or no direct test is there that which can assess the difference between the non-parametric test applied. But in the case, if you have any doubt about it, just say him that please give me graph on that, and graph can represent so whether they are a statistical significant or not.
Okay, the charts you mean?
Yeah.
Thank you, Dr. Rupali. Now, while Dr. Jayant is trying to inspire our participants to ask questions, Dr. Jayant has asked me to ask Dr. Ashish, when is the correct time to begin the discussion with a statistician such as Dr. Ashish in relation to a research study?
Sir, you can mail me and we can discuss anytime. It is best time that in the 6 to 8. That is not my official time. It is my time, I can discuss anything.
No. Oh, you mean the time of day? That's when you are having your sleep.
Yeah, evening, 6 p.m. he's saying. Like.
Yeah, that's what I'm saying. That's when he's having the sleep before he has the sleep.
Okay.
So, no, Dr. Ashish, thank you very much. You have highlighted, you have answered very correctly that you are available to discuss with any researcher, any study, right at the beginning, not at the end, right at the beginning.
Okay.
That's, you see, right? You've given a very clear answer. Yes, that is correct. Very good. And colleagues, participants, you now know that Dr. Ashish is available at the planning stage of your research.
Yeah, we can.
Yeah, thank you, sir.
Planning stage. I will be available.
Thank you. Thank you. You see, Dr. Rupali, how well you have persuaded Dr. Ashish to do all our hard work. Well done, Dr. Rupali.
Geddes, can I just ask a
Jayant,
question?
you
Yeah.
already
Can I just
asked
ask-
loads of questions.
Yeah.
Go ahead.
No. This questions or this particular question is for our delegates. Delegates, you joined this webinar to learn something from how to publish, understand what the statistics is involved. We can't see you because your videos have been turned off. It would be nice to see all the participants, but for you to interact with us, how many of you are currently involved in doing some research? Number one. Number two, what are your topics? Number three, do you need any help, or has this webinar helped you to understand what is required? Quick answers, yes or no, from all of you, please.
See, Dr. Rupali, you see how tough Dr. Mehta is? You are supposed to be inspirational, not bossy.
Dr. Loveleen Sodhi, I see you on your camera. It's on video. Welcome.
Thank you.
How do you feel the talk has been so far?
The talks were really very nice, and Dr. Ashish, it's good to know that he would be able to help us in our future endeavors to start any kind of or publish a paper or write a paper. So that is one very good thing that has come out of it.
And are you currently involved in any research yourself?
Not really.
Any reason why not, ma'am?
I practice solo. I mean, I have now juniors to help me with it. So I think it's just that I have my hands full, and doing good research requires a lot of time and dedicated effort. And then somewhere along the way, and usually in a solo practice, when you do not have very large numbers, that also is an inhibiting factor. We need to, kind of get together and pool our data, pool our results. That's what I've been thinking of doing. That maybe with that, once you have bigger numbers and you work as a group, it's kind of hold each other's hand, and then we can proceed further.
That's a very good answer that you've given, is in terms that you are asking a right question. For the question that you're asking, you need the data and how many patients you require for that. And this is what everyone should understand, that before you start embarking on a research, ask that specific question that you want to answer and see how you go around that. And I don't see any reason why you should not start collecting data right now. Think of a question, formulate it, start collecting the data, and then when you feel that they're sufficient, and Dr. Ashish has just agreed to help us out, speak to him, find out what is the minimum number of patients you require to answer that particular question.
Dr. Loveleen, right. Dr. Jayant has been going blah, 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 blah. Dr. Loveleen, because you are so busy, your younger colleagues should immediately contact Dr. Jayant.
Right.
Immediately, because he will guide them so you can do all your busy work.
Absolutely,
Dr. Bharati, you are waiting, you're eating your fingers, waiting to ask a question. Please, Dr. Bharati.
No questions.
What do you mean, no questions? Yes, question. One short question.
Geddes, can I just interrupt? The name pronunciation is Bharti, not Bharati.
That's okay.
He tries to make me cook onion bhajis. No questions, thank you. Dr. Patil, Anjali Patil, please speak to us.
Good evening, everybody.
Good evening.
Good evening. Actually, sir, I'm a teacher, and we have to do some researches also. Already I'm doing a research on about the role of pioglitazone in PCOS, and I have very good results. But then I would really need the help for that, so that even I can publish in our IFS journal also.
Please contact us with your questions and what your study plan is, and we'll try and help you as much as we can and guide you correctly.
Oh,
And first, your first call is to Dr. Ashish.
Yes.
Right,
yes,
good.
thank
Thank
you.
you. It's now, we're starting to run out of time. Burning questions. Who has a burning question? Ah, good question. I have received a little note here saying, am I sure that Dr. Ashish only had 2 spelling mistakes in his slide?
Yeah. Yeah.
Not
He
Ashish.
didn't make it. And no, that's Dr. Amin, Ashish Amin,
Yes.
not Ashish. Dr. Ashish,
Exactly.
he has no spelling mistakes in his slide. He's been around for quite a while. Right. He and I are old friends. I look at his slides before he puts them up. Dr. Rupali, do you want to wind up so that everybody
Just one more
can...
question before we wind
Oh,
up.
another, what?
One
What time
more.
is dinner?
A question to Dr. Bharti, if I may ask her. Dr. Bharti, you've been involved in publication for a very, very long time. Do you feel there are things that we've learned today when you joined us in our talks, or do you feel that there is a need for more extensive communication and understanding?
Actually, Jayant, what happens in India especially, uh, it is very difficult to collect the data in a right format.
Okay.
That's our basic, because everything is not in the computerized. So it becomes very difficult, and very busy practitioners usually uh, doesn't feel each and everything in the data format. So, and you all know that unless there is a data, because we were involved in Lotus 2 trial. Uh, I'm one of the author in Lotus 2. I remember that how much the people had helped for our data to be, into all patients' data to be putting in the computer and data format, Excel sheet. So that becomes very difficult, and that's how I think we are lagging behind. There are many questions to us. We would like to have the publications, but then this doesn't happen. Right now, I'm also facing the same thing. Like, we have questions, but then sitting up and doing the things all alone, it becomes very difficult. So, but if suppose IFS has been helping now with Rupali, and I think you all people are behind Dr. Ashish, he said, that will be bit easier. It is just getting stimulated. I felt today little enthusiastic again to come back in the small publications.
Good.
Not very good, but at least whatever I have my patients, let's come get together. But all alone was very difficult, truly speaking. But then now Anjali is a professor, Dr. Anjali Patil.
Yes.
She's a
Yes.
professor, and she has done a very good pioneering work in male infertility, tuberculosis and male infertility. She had done a lot of things, and she had published also. But I think it requires little help, definitely. And we don't have that great help. So, but now IFS with our Sterility Journal, Fertility Science Journal, all will be easier. And you people are there. I think Professor Dr. Gidas is also there. So, thank you so much. So let's see, this is stimulating. So let me think about
Sure. I think we should conclude by saying to all of you delegates, please come forward with your ideas, with your questions, and let's see how we can help each other. So don't shy away from even the basic questions that you may have. Thank you.
We're not going yet. Jane, please announce that we are sending a feedback form, which must be completed before we send certificate of attendance.
Yes. One of the things that we are trying to achieve, dear delegates, is to get a feedback from you all, asking you simple question, whether you enjoyed this webinar, was it helpful to you? How would you like us to improve? And number 3, are there any topics that you feel are important? We also like to know from you if there was a workshop to be organized at during Fertivision 2025, would you participate in it? And also, what sort of role would you like to play? Would you like to participate as a delegate or help us with as a faculty, as a panel, or
Jayant,
whatever
we're running
you
out of
like?
time. Do not give a lecture.
So, no.
Feedback
So
form
please
is
come
being
through.
sent. Thank you, Jayant. Thank you,
Thank you.
Jayant. Dr. Rupali, please wind up gently and quietly, not like me and Jayant, and not like bad boys.
A big thanks to all the faculty as well as all the delegates for attending and interacting. I think it was quite a nice discussion which we had, quite a meaningful one. Looking forward for more, monthly meetings. We are having monthly meetings. We definitely want you people, everyone, to answer what Dr. Jayant Mehta has just asked all of you to be answering. We'll send you handouts to answer that as well. Thank you. Thanks a lot.
Dr. Rupali, don't let Dr. Jayesh Amin leave. I need to talk to him about his spelling. Yep.
There. Thanks a lot.
Thank you, Dr. Gadis.
Can all,
Stay there, Dr. Amin. Jayant, you stay there too.
I'm also staying back. All
Yes,
other-
Dr.
Oh,
Rupali
dear.
stays back as well.
Yeah.
Okay.
Good night.
Dr. Amin, spelling of research, I think in the third or second last slide that you showed.